eye health should be part of overall athlete care. So regular eye checkups are essential, and inform your ophthalmologist what type of exercise you practice. And as someone who works every day with patients affected by glaucoma, I strongly believe that prevention starts with understanding.
Hi, Feliciana. It's my pleasure to have you on the Evidence Strong show. If you could briefly introduce yourself.
Hi, Alex. Thank you for the kind invitation to talk about this interesting topic. My name is Feliciana Menna. I am an ophthalmologist. I work at Terracina Hospital. In my daily clinical practice, I mainly take care of patients with retinal diseases and especially glaucoma. And glaucoma is really a condition that can slowly damage vision without pain, without early symptoms. So that's why I love this aspect of ophthalmology, and that's why, especially in glaucoma, prevention and early detection are really important. And alongside my clinical work, I am also a researcher, and one question has guided my research. So I thought, how does what we do with our bodies, and especially physical exercise, affect our eyes?
That's perfect. So, my audience is mostly strength sports athletes and coaches. So, we all know that physical activity and strength training are important for general health. And of course, for the athletes, this is bread and butter. So, they want to get better, they want to get stronger, they want to get more powerful. But some conditions may develop.
Yes.
So, the question is whether it's from exercise, is it the exercise is just speeding it up? What do we know about exercise and health of the eye?
Yes. So we have to say just a few things before this question. So we have to know that inside each of our eyes, there is a fluid that maintains the ace shape, and the pressure created by this fluid is called intraocular pressure. However, when eye pressure becomes too high, or when it changes too much over time, it can damage the optic nerve, which is the structure that sends visual information from the eye to the brain. So this damage is what happens in glaucoma. And glaucoma between ophthalmologists is called the silent thief of sight, because it causes no pain, no early warning signs, and unfortunately no sound effect either. So we really have to look for it. And many people don't realize there is a problem until damage is advanced. That's why doctors care so much about intraocular pressure. And the eye pressure normally is measured in ophthalmology clinic with a test that is called tonometry. That's quick, safe, and painless. But what many people don't know is that eye pressure changes during the day. It can be influenced by body position, breathing, stress, physical effort, and yet we usually measure it when a person is sitting calmly in a clinic. So I began to wonder what happens to eye pressure when people exercise intensely, as athletes do every day. And so we all know that physical activity is good for health. We all know exercise is good for the heart, the lungs, and the muscles. But the eyes, they don't exactly go to the gym. So yet they clearly feel the workout. But not all exercise is the same. There are two different types. So we focused on endurance exercise, like running or cycling, and strength exercise, like weightlifting. Previous study suggested that endurance exercise might slightly lower eye pressure, while strength exercise could temporarily raise it. However, very few studies had directly compared different sports. This is why we decided to design a study that focused on real athletes in real training conditions.
Let's maybe dive into your study because you specifically designed a study looking at eye pressure in two groups of athletes.
So we studied 40 healthy young athletes, all between 18 and 35 years old. They were divided into two groups, so marathon runners and weightlifters. All of them were in their first year of competitive training, and none of them had eye disease, glaucoma, or other medical conditions. So we measured their eye pressure at rest just before training and immediately after 1 hour training session. And we used very precise instrument, including the same method eye doctors use in hospitals. Our goal was really simple, so to understand how different types of sport affect eye pressure.
In terms of training, they did their usual training?
Yes.
Or you
Yes.
prescribed the exercise session?
No. Absolutely. Usually training, yes.
All right. So did you measure it one time or was it a longer study?
Actually, we took fast 1 year to complete the study. Yes. In total, we included 40 male athletes, and they were divided into two groups based on the type of sport they practiced. So 20 marathon runners representing endurance sports and 20 weightlifter representing strength or resistance sport. To ensure accuracy, we used two instruments: Goldman applanation tonometry, that's the clinical gold standard, and rebound tonometry, which is faster and a little bit more comfortable.
So these are the measurements you have done. You measured it many times over 1 year, you said?
Yes.
Wow, this is impressive. 1 year, it's a long study. Okay, what has found?
So what we discovered, so the results were very clear. So in marathon runners, we observed that actually eye pressure stayed stable or slightly decreased after training. So this suggests that aerobic exercise helps the eye regulate its pressure. Strength athletes, so in weightlifters, eye pressure increased after training. In about 1 out of 3 athletes, the increase was quite large. So, and we also found that the heavier the weight lifted, the higher the increase in eye pressure. And these were young, healthy people with no eye disease, and yet their eyes were experiencing significant pressure changes.
So large changes, you said. Is it large enough for you as a specialist to worry?
Naturally, people with no eye disease have not to worry about, but people with glaucoma are really known, or people with a family history of glaucoma have to worry about. Yes.
So for normal activities of daily life, I don't know, if we pick up groceries, will we also pick up a child, something heavy, so you strain yourself a little bit, but it's a short activity, I don't know, a few seconds, you carry to the car, groceries, maybe 3 minutes, 5 minutes. Will the eye pressure rise with this activity too?
Pressure changes. Pressure changes during the day. It depends also. Eye pressure follows the circadian rhythm. So also without doing anything, eye pressure changes. Naturally, these changes are absolutely not so large that no. So also for light weight, we have not to consider that. Also, when we drink too much caffeine, too much coffee, that could be a risk. So, but are really. Yes, too much coffee also can impact eye pressure. Yeah, it is not so good. Yes, absolutely. But we talk about like small changes. are small changes that we have not to worry about. But people with glaucoma have to. So that's especially recommendation for people that has a ready diagnosis or family history of glaucoma. That's the most high risk factor to develop glaucoma.
Okay, you mentioned that caffeine is also influencing eye pressure. Could you explain?
Yeah, so we have to think about that small things that we do every day can have a great impact in general on the body, but especially from a point of view of an ophthalmologist on our eyes. And we have to think about, so for example, also too much coffee. So I talk about I two or more than 2 or 3 coffee in people at risk can have a negative impact on eye pressure.
So I'm not sure whether you know, but the weightlifters drink pre-workouts, so energy drinks, coffee, whatever they can, maybe an hour before the training, so they feel really energetic and they can perform really well in heavy training. What would you say to that?
It's a really good question, because also this is very, very important. So in people at risk, they should not drink so much energy drink. No, because we all know that this energy drink, yes, it's perfect for energy and everything, but also for energy drink, I will suggest in people at risk to not drink them.
Because the weightlifting exercise raises eye pressure, then on top of it, the energy drink, because the doses of caffeine in energy drinks are really, really high. So this is a double dose for the eye.
Yes, in different studies was observed that actually consuming 340 milligram of caffeine showed statistically significant pressure increases.
Yes.
So we have to worry about that.
All right. What else have you found in the study?
So why these important changes between marathoners and weightlifter? The reason lies in how the body behaves during intense strength exercise. When lifting heavy weights, many people hold their breath, contract their muscles strongly, increase the pressure inside the chest and abdomen, and this pressure is transmitted to the eyes and can temporarily block the normal fluid drainage inside the eye. Running, on the other hand, encourages regular breathing, improves blood circulation, helps the eye maintaining balance. So naturally, this not mean that weightlifting is dangerous. Absolutely no. But it tells us that the eye respond differently to different types of effort.
So it's not outside of the body. If we hold breath, if we raise pressure in the upper body by Valsalva maneuver, holding breath and bracing, the eye will experience the same. So the fluid will not drain as quickly or fluidly, and it will stay there creating this pressure.
Exactly.
Now you measured after training. So how long after training the higher pressure in the eye you think will be lingering or staying?
So there are not so many studies about this point, but until now, as ophthalmologists, we think that acute eye pressure increases can last over 1 to 4 hour period, but new scientific evidence should be performed. So I will say 1 to 4 hour period after training, but we need more evidence about that.
Okay, another question, a little bit tricky one. So you said that eye pressure fluctuates during the day. It follows the circadian rhythm. So when it is the lowest?
The lowest in the evening. In the evening, normally after 6 p.m., normally it's the lower, yes.
So if a person is worried, has some signs of glaucoma, and they are worried about eye pressure, if they schedule the training at 6 p.m., will it be the safest time for them to train?
It could be absolutely. I will suggest for sure sure, we always talk about people at risk. So I don't want to disseminate panic. So really, people at risk with only people with already known glaucoma, or as I said before, family history of glaucoma, I will suggest that could be a good option to ask for eye pressure measurement to an ophthalmologist, and maybe it could be, yes, it could be a possible solution. Yes.
If a weightlifter is training hard and they're holding a breath and they're training, if they go for a run after the training session, will the run regulate the eye pressure?
So, from an ophthalmologist perspective, weightlifting, particularly associated with Valsalva-like maneuvers, can induce transient spikes in intraocular pressure, and subsequent running does not necessarily eliminate this acute eye pressure elevation, even if naturally it's beneficial for overall cardiovascular health. So while the combination of weights followed by running may be reasonable for in general, large and repeated eye pressure spikes should be avoided in subject at risk with glaucoma or with a strong history of glaucoma, as I said before. So in these individuals, minimizing excessive strain, avoiding breath holding, and favoring controlled breathing and moderate loads is advisable, along naturally with regular ophthalmologic monitoring.
So a safe way to know is to measure at the doctor's office to know whether in general the eye pressure is high in a given person, and check for glaucoma. If there are no signs and no family history, it's probably safe and no problem, and you can forget about today's conversation, not think about it for some time. But if there is a history of glaucoma and someone is training hard and doing weightlifting, would you say that it's worth checking periodically eye pressure at the doctor's office and keeping an eye on it?
Yes. Exactly. So really the key point, so for athletes in general, strength training is healthy, but naturally awareness is important. Breathing correctly, that's also very, very important during exercise. That may help reduce eye pressure spikes. So breathe immer correctly. For coach and trainers, so eye health should be part of overall athlete care. So regular eye checkups are essential, and inform your ophthalmologist what type of exercise you practice. And as someone who works every day with patients affected by glaucoma, I strongly believe that prevention starts with understanding that eyes are not separate from the body. They respond to how we move, how we breathe, and how we live. So sport teaches us a lot about human physiology, including how delicate and adaptable our visual system is. And by understanding this connection, we can protect vision while continuing to enjoy the benefits of physical activity. If there is one practical takeaway from today, is this: breathe while you lift, and your eyes will thank you.
All right. Usually I ask 2 short questions at the end of each interview. The first question is, what is your favorite exercise?
My favorite exercise is running, actually. Yes, from a personal point of view, running is simple, helps me to maintain physical and mental balance. So, yeah, actually is especially running.
Great. And the last question is, if people want to see what you're up to, maybe read your newest research, where should they go online?
People can find my work and my contacts primarily through scientific publication and academic platforms. Feel free, everyone, to contact me. I am really always open to scientific collaboration, discussion, and if you have questions, I will be happy to answer them.
Thank you, Feliciana, so much. It was a pleasure.
Thanks to you. You're welcome. It was a pleasure for me.